Hi, this is Dr. Bhargava, and in this short video, I'm going to share with you 3 interesting cases. One with thyroid uptake on DOTATATE PET-CT, second is a PSMA PET-CT, and third is FDG PET-CT in a breast cancer patient that was diagnosed during pregnancy. Here's our first patient. They were found to have a neuroendocrine tumor polyp that was resected at the time of upper GI endoscopy from the duodenum. A whole body DOTATATE PET-CT was performed for staging. Here on the rotating image, we find that there is physiologic distribution of the tracer, including the characteristic uptake in the pituitary, uptake in the spleen more intense than the liver, and excretion from the kidneys into the urinary bladder. The interesting finding is right here, increased uptake seen in the enlarged left lobe of thyroid. This patient has had prior right-sided hemithyroidectomy. The uptake is mild and heterogeneous, also seen here. The left lobe of the thyroid is enlarged and shows heterogeneous uptake, and the ultrasound showed multiple nodules. So this finding is consistent with a multinodular goiter showing some uptake on a DOTATATE PET-CT. Here is a related article. Here the authors conclude that patients with focal DOTATATE uptake should undergo further examination due to potential risk of malignancy. Diffuse DOTATATE uptake was predominantly associated with active autoimmune thyroiditis or benign goiter. The focal lesions and diffuse pathology diseases were frequently seen in women. Here's our next patient. They were diagnosed with prostate cancer and they underwent a PSMA PET-CT for staging. On this rotating image, we find characteristic uptake in the lacrimals seen bilaterally. There is faint uptake in the salivary glands, uptake in the liver, less intense in the spleen, and excretion from the kidneys into the urinary bladder. Inferior to the bladder, we see 2 foci of increased uptake in the prostate, also shown here, consistent with their primary prostate cancer. The value of this scan is in ruling out metastatic disease. They do not have any pelvic nodal metastatic disease or any bone metastases. So this patient can undergo a definitive treatment for their prostate cancer. Here is a great review article on the topic of PSMA PET-CT. Here the authors say that knowledge of physiologic distribution of PSMA and other causes of uptake is essential to minimize false positive imaging findings. This is our next patient. This patient is a young female who has recently been diagnosed with breast cancer and underwent a whole body FDG PET-CT study for staging. On their whole body image, we find that they have a large hypermetabolic mass in the right breast, which is consistent with their primary breast cancer. There are hypermetabolic axillary nodes on the right side, and also we see pectoral nodes in between the pectoralis major and minor muscles on the same side. The interesting thing about this study is that there is linear increased uptake in the pelvis. This is seen right here on the fused PET-CT image. This is uptake in their C-section scar. They had a recent C-section and there is inflammatory uptake in the scar, and that makes this patient's breast cancer a pregnancy-associated cancer. And here is a review article on this topic, Cancer in Pregnancy, where the authors say that pregnancy-associated breast cancer is seen in 3 out of every 1,000 pregnancies and is increasing in incidence as women delay pregnancy. This type of breast cancer is more aggressive, and not infrequently there is a delay in diagnosis attributed to physiologic changes that occur during pregnancy and a lack of awareness among physicians. Thank you for watching.